Is Minnesota ready to respond when emergency strikes? WCCO investigates.
There is no city, there is no administration that is going to be more prepared than we are.
We're digging in and getting answers from top officials to uncover lessons learned from civil unrest.
We don't wait for things to become worse or more difficult.
The COVID pandemic.
You feel that way, like it's inevitable that another one of these will come around?
I do. I don't know what it will be.
Or a cyber attack.
An attacker has to be right once, but as someone who is responsible for defending our systems, we have to be right 100% of the time.
We check in with first responders who train for active threats.
I think what we've all learned over time is we have to have these disciplines working together to most effectively enter and engage and stop a threat.
And see what it takes to limit Minnesota's biggest weather threat, flooding.
When I ask, are we ready? It sounds like yes, and it's a work in progress.
Exactly. WCCO investigates our state of emergency.
Hello, I'm Senior Investigative Reporter Jennifer Merrily. Thank you for joining us for State of Emergency. It's a part of Minneapolis history many of us will never forget. The police murder of George Floyd and the civil unrest that followed captured the attention of the nation in May of 2020. We ask what's changed, and are agencies better prepared to respond to civil unrest?
The images are seared into collective memory. Some of the darkest hours in Minneapolis history. Protests erupting into riots, looting and arson following the police murder of George Floyd. The 3rd Police Precinct given up in the mayhem. The city was woefully unprepared to respond to the enormity of the events.
What's so problematic around 2020 is there wasn't one incident. It wasn't one location. It was hundreds of different locations across the city.
An after-action report found Minneapolis mishandled the response, didn't follow emergency procedures, lacked leadership, structure, coordination, and communication. It offered 27 recommendations Mayor Jacob Fry says they're nearly done implementing.
And so I'll tell you, in terms of dealing with crisis, in terms of dealing with emergency, and in terms of the work that we've done over these last several years to be prepared, there is no city, there is no administration that is going to be more prepared than we are.
He says that preparedness started with the creation of the Office of Community Safety.
Commissioner, thank you so much. We are thrilled to have you.
Now led by Commissioner Todd Barnett. One office to provide a unified command overseeing police, fire, 911, emergency management, and neighborhood safety.
Make sure the communication is clear. Make sure we're prepared. Make sure that you're training people that they are prepared.
Barnett says the city now follows NIMS, the National Incident Management System, also used by partners like Hennepin County and the state.
So it gives us that structure of here's our roles and responsibility. So we know that we have an incident command system, and we know we have an incident commander on the ground. If there's a need to bring in any services from the county, we're working on that same structure, same thing with the state.
Mayor Fry says responders have trained for emergency scenarios, including civil unrest.
So much of it is making sure that the internal communication pathways are in place to make sure that the external execution is improved, to make sure that directives that are given and or information that is received is going to the right people at the right time.
You said we're prepared. Can things still go wrong?
Of course. You can be 100% prepared and have done everything correctly and still be overwhelmed at the same time.
The police department has lost hundreds of officers since 2020, more than a third of the force. If unrest were to happen tomorrow, Minneapolis would likely need help from local partners. The Department of Public Safety says it's using what it learned to better assist communities.
We don't wait for things to become worse or more difficult. We're reaching out on the front end to make sure if there are more resources that may be needed or technical advice or expertise that may be needed, that we're ready to be there to do that. I'm talking with the Adjutant General from the Minnesota National Guard right away, before anything even comes close to that being a potential for activation.
Current Commissioner Bob Jacobson stepped into the role last year. He says they're also working on stopping a situation before it starts or escalates.
What we're trying to do is get ahead of that, to build those relationships, to talk to the important community members who have influence within our communities, talk to them before the bad things happen. And those relationships are open, they're ongoing.
The governor declined our request for an interview. In March, a team of roughly 60 people from Minneapolis will go to Maryland for a FEMA exercise. We're told it will cap off the emergency preparedness work that's being done. There's no question 2020 tested us all. The healthcare industry was no different thanks to the COVID-19 pandemic. But experts say history could soon repeat itself. David Schumann shares what we learned and why the threat of another deadly virus is very real.
And my best science says that this wasn't the big one. The big one is yet to come.
Dr. Michael Osterholm doesn't mind if you call him a doomsayer. As the director of the Center for Infectious Disease Research and Policy, he wants to talk about preparedness.
The real challenge we have in terms of responding to the pandemic is we have just cut back so much in terms of our healthcare resources. We've eliminated over 40% of the pediatric beds in the state in the last 5 years.
Osterholm also believes the trust in public health and its messaging during a health crisis is shattered. Perhaps fittingly, Minnesota state health officials point to communication, and particularly persuasive communication, as their top challenge for the next pandemic.
What we were learning about the virus was changing so rapidly, and so the guidance we were receiving was changing, and it's hard to communicate that rapidly to the public who's like, but wait, last week you said this.
MDH's Director of Emergency Preparedness and Response says at the time, guidance called for lockdowns, mask mandates, and closures of schools and businesses to minimize the spread.
The decisions that were made did save lives. I truly believe that.
And in a future pandemic,
everything will be looked at as on the table again.
One difference would be that now the state has a warehouse full of PPE ready to go in case of emergency.
It will be to make sure that we don't see a collapse in the healthcare systems.
Dawn Rameli has her own small-scale version of a PPE supply. COVID changed the way she thinks about life when the virus put her brother Chris in the hospital for more than 200 days in 2020. I'm home! Chris died last year at 53 years old. His quality of life never returned after his bout with COVID.
When he first got out, he really couldn't move at all. 180 degree from what he was prior to COVID.
So Dawn says she can't take any virus lightly and would closely follow future pandemic precautions.
I don't really live in fear. I think I'm just cognizant, being really thoughtful of the risk that's out there now, which I never really considered before.
If the challenges going forward are communication and resources like hospital capacity and staffing, experts say the medical response to COVID was as good as can be expected.
It was simply amazing that we did have the vaccines we did within a year. And that is a remarkable accomplishment.
State health officials say you can plan, you can drill, but none of that can ever be more than just a framework.
We've had staff who, during preparedness time, are like, oh my gosh, I want it to be cut and dry and black and white. You're not going to get that in this discipline.
David Schumann, WCCO News.
A pandemic response plan from April of 2020 is on the Department of Health's website. We asked if it's been updated since then, and they said it's a continuous process that isn't ready for publication yet. Coming up, how agencies in one county are coming together to be better prepared for an active threat. Plus, we ask if hospitals are ready for an influx of patients. And we learned about the investment the medical examiner's office made to ensure they're ready to respond. We've heard the headlines too many times. A person has opened fire, hurting people and killing others. There were more mass shootings than days in 2023. So how ready is Minnesota to respond? We discovered agencies in Hennepin County are working together.
These are images of a training exercise to prepare first responders when faced with an active threat and the potential for people being hurt. Agencies in Hennepin County joined forces a decade ago.
An event like this, we all know, is a horrible, terrible event. And we need to be prepared when this event happens to act and perform at a very fast pace. Because at the end of the day, it's about saving lives.
A regional response board made up of police, fire, EMS, and dispatch work in tandem.
And I think what we've all learned over time is we have to have these disciplines working together to most effectively enter and engage and stop a threat, and then evacuate injured and take care of those people.
All of us play a piece in that. And when one of those pieces falls out of line or doesn't do their part, that's when things start to break down. You know, we all have to be on the same team.
No matter how big or small an agency is or a dispatch center, we can't handle this alone.
The all-day class is repeated a dozen times a year, so more responders can gain tools from the training.
Everything from orientation to basic command structures.
They say it's classroom work coupled with hands-on learning.
911. 911 dispatch centers, that's where the first call comes in, providing that information to all agencies.
And we really focus on what we'll call the crisis phases. The first phase is for law enforcement we get the call and they engage, right? They get to the event, we get there. Phase 2, they've entered the building and they're making the building safe. We continue through these phases of the training.
We look at debriefs that have come out. We look at talking with people from the state across the nation about other incidents and learning from them.
And they do focused sessions too.
We do a lot of training with, stop the bleed campaigns, tourniquets, bleeding control, things like that. But then ultimately getting the patients to definitive care. They need to go to a hospital.
With those breakouts, we're listening to other incidences, mass casualties, shooters around the world, around the United States, and just listening to those. I think the biggest piece that we've learned is to communicate and to get that on paper and to train that way.
By doing that, you are eliminating those potential problems when you get to a situation. Is that right, or is that the goal?
I think so. It's that, again, planning ahead, knowing what each discipline is going to be doing, their roles, their responsibilities, having that overall communication.
What can't you prepare for?
What that incident's going to be.
And where and when.
Yep.
Have to be ready every day because you don't know when or where.
You just asked a question that made us all take pause. For me, that pause was because I don't want to answer it. I want to train for everything. I want to be prepared no matter what. And I know that's not realistic, but we're going to do the best we can, and we're prepared to go the extra mile no matter what.
What about the people that need help in an emergency? How prepared is Hennepin Healthcare to handle multiple patients at once? And what about the medical examiner's office? We explore what's in place should the unthinkable happen here.
Any given day, first responders rush patients to the emergency department at Hennepin Healthcare. Mock patients, played by high school students, help the Level 1 Trauma Center during drills to get ready for the unknown disaster.
We like to talk about space, staff, and stuff, or supplies. So if we get inundated to the point where it overwhelms our capacities and our capabilities, that would result in a mass casualty incident. So anything that would overwhelm us would then activate the mass casualty incident. When we pull that lever, we're bringing in folks from off campus to come support us.
Seth Jones's job as Emergency Preparedness Program Manager is to think of everything.
This is where hospital leadership comes in.
They stand up the hospital incident command system during a disaster.
You have this organization chart.
Yes, this is our org chart, our response org chart.
People who meet in this room make sure the hospital has what it needs.
Multiple casualty incidents, so this is what it takes if something happened in the community.
He says communication continues to be something they work on. And they've done drills with blood banks too, which can be in demand depending on the disaster.
Why is it important to prepare ahead of time?
These events have happened, whether it's Pulse nightclub shooting, the shooting out in Las Vegas. We always keep track of best practices, lessons learned from these incidents, because these are continuing to happen.
Should an event take a more tragic turn, Hennepin County Medical Examiner Dr. Andrew Baker says his office is ready.
Within hours, we can turn this garage into a mass fatality processing morgue.
Baker has experience with disaster. He responded to the war in Kosovo, 9/11, and deployed during Hurricane Katrina. His office handled identifications and autopsies of the 35W bridge collapse victims. He says they had those people in the back of their minds as they built a new multi-million-dollar office.
One of the things we intentionally baked into our garage was enough power outlets so that we could have fingerprint specialists, personal effects specialists, anthropologists, forensic dentists. We can power all their workstations right here within our building. We have 2 loading docks to which we can affix refrigerated trucks. We have enough space on the property that we could put pop-up style hospital-type tents that are climate controlled.
And he says a state-of-the-art CT scanner is critical if the disaster involves something like a shooting, where it can detect bullets.
Why does that matter to be able to have these capabilities?
Every medical examiner lays awake at night wondering what they would do if the next mass disaster was in their community. You have to plan for that, you have to train for that, you have to drill for it, and then of course, like everyone, you hope that you never really use it.
Hennepin Healthcare says it continually evaluates its training and updates it with best practices. The next big training is in June, where they'll also work on family reunification. Next, our team investigates cybersecurity. Meet the group tasked with keeping us all online. Plus, we look at our greatest weather emergency, what's being done to protect communities from flooding, and the risk that remains. Welcome back. We're taking a closer look at our cyber defenses. Last year, lawmakers added $32 million to keep us safe from cyber attacks. Jonah Kaplan looks at how that money is being spent and what's at risk.
Has this hospital been under attack?
Multiple times. We're probably under attack right now. It's something that we're routinely prepared for.
Jan Krivchenko is the Director of Core Technology and Information Security at Hennepin Healthcare. His team has more than doubled in the last 4 years, and for good reason. First, there's this University of Minnesota report revealing a staggering rise in cyber attacks against hospitals. Then there's this warning from the U.S. Department of Homeland Security about imminent cyber threats to healthcare facilities across the country. A cyber attack here could be much more than just stealing personal data.
We have over 50,000 computers, devices that are making this operation possible.
50,000?
50,000, correct. They could be anything from a large-scale computer to an infusion pump that decides how much fluid goes into you. And most of these devices have to talk to someone or one another. Most of them are critical to providing care. I mean, some of them are nice to have, but a lot of them are absolutely critical. So at some point, the difficult job of doing what my team does is continuously reevaluating what is it that we have, which vulnerabilities we can live with, which vulnerabilities we have to fix.
Healthcare is just one of many categories of critical infrastructure that are increasingly vulnerable to cyber attacks. Think transportation, communications, finance, and energy. They're massively important and massive targets. Just look at these scenes from a few years ago.
The company shut down its pipeline Friday after a cyber attack compromised its IT system.
Russian hackers shutting down the Colonial Pipeline, which supplies more than half the amount of gasoline to the East Coast.
We know there's a war going on in the Middle East. We know Iran is involved a lot. We know about Russia. How big a threat to us comes from these state actors?
I think we're under constant kind of cyber threat.
Minnesota's Department of Information and Technology, or MINIT, secures data and information for nearly 6 million Minnesotans. Officials there also recently rolled out what they call the whole-of-state approach, the first statewide cybersecurity defense plan. Chief Security Officer John Israel says being prepared for an emergency needs 2 stages of readiness, one online and the other on the ground.
In response to a flood, for example, there's really not a lot we can do to remove the water. It's really about what can we do to support the people and the businesses to reopen and protect society. Same thing in a cyber attack.
MINIT participates in at least 2 yearly preparedness exercises, one on the state level, the other with federal partners, called Operation Cyber Storm.
We brought in people from the transportation sector, from the energy sector, water utilities, metropolitan airports, and others to look at what would we do in the event of a large-scale cyber event.
Still, the message from Minute is that everyone plays a part in cyber defense. And that's a theme repeated again and again by Jan Kravchenko to his colleagues at Hennepin Healthcare. We can't do this alone.
In security, we have a saying that, the biggest security vulnerability is somewhere between the keyboard and the chair.
In Minneapolis, Jonah Kaplan, WCCO News.
Here are some tips to improve your cyber defenses. Use strong passwords and don't use the same one twice on other accounts. Avoid phishing scams by only opening emails from people you know. Enable multi-factor authentication for access to apps and logins. And finally, remember to log off any public computer or network. From virtual threats to natural disasters, we've seen wildfires in Hawaii and hurricanes along the Gulf Coast change communities. Minnesota has its own dangers like blizzards and tornadoes, but we've learned our greatest threat is flooding. You may remember the costliest flood year in state history, the spring of 1997 along the Red and Minnesota rivers. FEMA estimates $300 million in public infrastructure damage, impacting 58 of the state's 87 counties and impacting nearly 25,000 families. We explore what's being done to reduce the risk.
Stories of the historic 1965 spring flood in Henderson are still being told today.
A lot of the homes were flooded. Actually, the house that I live in was flooded over the first floor, and it's a two-story.
That's how they rescued people.
Yep.
Tom Phillips was a teenager at the time.
That's what they used in '65.
Living nearby. He's now Henderson's emergency management director.
Some of them had enough guts or nerve to jump on the ice chunks and guide them around the houses so they wouldn't smash the houses.
The city, along with the Army Corps of Engineers, built a temporary levee a few years later in '69.
The concern was flooding again.
Yeah, it was there. It kept all the houses that flooded in '65 dry.
Why is Henderson at such risk for flooding?
We're in the valley. It's a river town.
The Minnesota and Rush Rivers flow nearby. A flood control project in the 90s made improvements, but risk remains.
2014, we had a lot of rain for a long time, and we had a lot of slope failures. It came fast and furious. We actually called and had the National Guard monitor our levee and that for us for about a week or so.
The town was built up before floodplain management started in the state.
What are we doing to prepare for a flood?
Since 1969, 1970, we put laws in place to build smarter and not build in the highest risk areas. We're doing more of the mapping, figuring out what part of the floodplain is going to be really deep. The 100-year floodplain is the darker area.
Seal Strauss is a floodplain hydrologist with the Department of Natural Resources.
We oversee their ordinances that they adopt. We're helping the communities to enforce these things, giving them guidance on better ways that they can regulate. The biggest part of my job is keeping them out of danger in the first place.
When I ask, are we ready? It sounds like yes, and it's a work in progress.
Exactly. It definitely is a work in progress. We're better off than we were 50 years ago. We're better off than many of the other states. And there is still work to do.
The State Homeland Security and Emergency Management Office also helps communities prepare, starting each February when the Spring Flood Outlook is released.
We'll have conversations with them about, what their resource capacity looks like.
The office only actively steps in when a community has exceeded what they can handle during or after a flood.
We also start that coordination conversation with them so that we are ready, and we coordinate amongst our state agencies. We're ready to step in when the handoff happens.
And the office helps with state and federal funding for disaster declarations for counties and tribal nations.
What have we learned from past floods that are informing us for the future?
How important mitigation is, long-term planning and mitigation work. And we go in and we look at how can we help that community prevent that from happening again. And if it does happen, that the loss isn't as detrimental to that community or that homeowner or that business owner in the future.
Nearly 60 years after Henderson's massive flood, multi-million-dollar mitigation efforts there are still underway.
These are our stop logs.
And Phillips says they're ready for the next one.
6 panels on one highway and 7 on the other way. I know my resources and I know where to ask for them from. Lessons learned.
Something you can do to prepare? Know your flood risk. Head to WCCO.com. We'll get you to FEMA's MAP Center, where you can type in your address. Experts suggest getting flood insurance in flood-prone areas. Thank you for joining us for this special look at State of Emergency. For another look at these stories, visit WCCO.com and click on State of Emergency. I'm Jennifer Merrily for WCCO Investigates.